Welcome to Docs on Call, brought to you by Northeast OBGYN.
Good evening and welcome to the program. I'm Liz Schatzline. If you are pregnant, your ultimate goal is to have a healthy pregnancy and a healthy baby. Tonight we're going to talk about that and how you can make that happen. I'm very happy to welcome back to the program Dr. Jeff Cly. He is an OBGYN practicing in Fort Wayne. Nice to have you back with us.
Thank you very much.
And as I said, everybody who becomes pregnant wants to have a healthy pregnancy and a safe pregnancy. How do you go about doing that, Dr. Cly?
We're going to try tonight to talk about some of the secrets of how to have a successful pregnancy and delivery. And I think one of the overriding things for women to understand and believe is believe in themselves, because they've made it to that point of being pregnant. Even though pregnancy is a scary thing for many people, they can do it. And every woman that I see blossoms into womanhood and motherhood, and it's a beautiful process. And when they really take a look at how they're doing it and not try to be afraid of it, but embrace it and take the changes as they roll, usually everything turns out wonderful.
You know, it is a time for, we were talking before the show, I said even the most confident woman, when she finds out she's pregnant, for the first pregnancy, this is unfamiliar territory and the stakes are very high. So it is, your confidence can start to wax and wane as you go through it.
Oh, absolutely, and usually they find that everybody seems to be an expert on pregnancy.
Oh, yes.
From the lady in the grocery store to friends they know, and a lot of people like to actually tell them the horror stories about pregnancy. And so I usually try and say to the patients, let's take this one step at a time, and we actually do an introductory seminar for the patients, their husbands or partners, and then their family members, so that we can all be on the same page, so that as they move through the pregnancy, we can make it one of the best experiences of their lives.
Now, we were talking before the show about the perfect pregnancy. Dr. Cly, how many perfect pregnancies have you seen?
I don't think there's really any perfect pregnancy, and what we're referring to is that movie pregnancy where in the movies, there's so many movies about a pregnancy and then relationships through the pregnancy. And what I try and tell the patients is life still happens during that 9 months. And so you might have obstacles come up in your way, or family crisis, stresses, job issues that arise. But at the end of the day, they're still growing a wonderful baby inside of them. And that's the most important thing. And as we just take it day by day, these women and women do fantastic.
So you think the power of positive thinking really does have an impact during a pregnancy?
Oh, absolutely. It changes the pregnancy from blood pressure issues, from the way they feel, from mental, the outlook, baby's growth. It's amazing how that believing in themselves, positive thinking, and trusting in a higher power. Even if that higher power means that's their doctor or someone in their family because they feel insecure about what's going on. But kind of trusting that you're going to make it, it makes such a difference.
Okay, and I do want to mention that Dr. Cly will be answering your calls tonight. If you have questions about pregnancy, please give us a call, 483-8331. That's the number. Love to hear from you tonight. Now let's get into specifics about a healthy pregnancy, because you can go into it and think positive, but there are specific things that you can do. What should a woman be doing when she's pregnant?
Well, in the beginning, when she finds out she's pregnant, looking at her diet, looking at her lifestyle, trying to do the stuff that our grandmothers told us to do, is eat right, be healthy, exercise. And I kind of try to and let women know that not only are they working many times outside of the home, they might also be doing a lot at home for their partner. And then on the last thing they usually think about is the baby. Well, they're growing a baby inside themselves. So they're really pushing the body to the fullest extent during the pregnancy. So what I recommend is putting into your body the best stuff you can. Healthy foods, just cutting back on some of the fatty foods, the fried foods, trying to eat more vegetables, more water, cutting back on some of the artificial things. That can make a big difference on how a person feels from day to day.
Okay.
And then energy levels. Try to get some exercise. Even if you don't exercise, start exercising, even if it's just walking.
I was going to say define exercise, because that can mean different things during a pregnancy.
If someone's not exercising at all, I'd start with walking. If they already are jogging or doing some aerobics, keep doing that. Talk with your doctor about what's okay. And most things are okay during pregnancy. the abdominal workout gets a little bit difficult after the first couple months because of the baby. But with increased water intake, exercise can do wonderful things for the weight, blood pressure, and increase a woman's energy throughout the pregnancy.
I know a lot of people may be fearful of being too active, think that they're going to cause a miscarriage, but that the baby's resilient and the body's resilient, isn't it? It actually welcomes the exercise.
Oh, absolutely. And that keeps the blood flowing and keeps the muscles strong. And the uterus is a muscle. So by exercising the rest of your body, it keeps the uterus muscle strong as well. And actually can make a big difference at the delivery. So women who've kept their pelvic muscles and their core muscles strong find that they have a quicker, easier delivery with less pain.
It's going to pay off in the end.
Oh, yeah.
We'll get to some more specifics in a minute, but we have a caller waiting.
Great.
So let's go to the phone line. Sarah, good evening and welcome to the program. You're on the air.
Hello.
Hi.
Hello.
Hi. I'm 10 weeks pregnant with my second pregnancy, and I have been having a brown spotting for the whole time. At what point do I become concerned?
Great question. And spotting is very common during the pregnancy. And if it's spotting and it's after activity or without cramping, then usually it's something around the cervix or as the placenta moves to its final position as the baby and the uterus grows, it leaves sometimes some spotting that has to come out, and it comes out through the cervix. So I would say from what you're describing, I wouldn't be concerned. I would definitely let your doctor know. And if that changes to heavier bleeding or some red spotting with cramping, with pain, that's a different story. But even that doesn't always mean a miscarriage is likely. So I would say let your doctor know, continue to be normal, be healthy, and it doesn't sound unusual at this point.
Okay, good news. We have Juliana waiting on the other line. Juliana, good evening. Welcome to our program. You have a question for Dr. Cly tonight? Hello, Juliana? Hi.
Yes?
Yes, go
Hi.
ahead. We can hear you.
Okay. I'm 20 years old, and I just had my first baby, and I got preeclampsia at the end, and my baby was born 2 months early, and she was only 3 pounds. And I was just wondering about, I would really like another baby, maybe 4 or 5 years in the future, but what are my chances of getting preeclampsia again?
Oh, that's a great question.
Great question, and congratulations, and I hope the baby's doing well.
Thank you. She is. She just went for her 6-month checkup, and she's 12 pounds and 5 ounces now.
Oh, my. She's a healthy baby.
Fantastic.
Yeah.
So the chances of preeclampsia is present, but it doesn't automatically come back. And what it seems to happen is the better shape you're in, your body's in, and that's mentally and physically, the next time you get pregnant will significantly decrease the chances of preeclampsia coming back. Additionally, when you find out you're pregnant next time, look at your life. You're going to be busier because of your daughter. You might be working outside the home. If you can, the next pregnancy, when you find out you're pregnant, try to start decreasing some of the potential activities that might come up. Give yourself a little more rest. If you're working 60 hours a week or 50 hours a week, maybe try to cut back a little bit if you can, or maybe not run as much after work. Those things make a huge difference on the length of pregnancy during preeclampsia or a second pregnancy after preeclampsia. So I think your odds are in your favor that you will do very well and be able to carry the next pregnancy farther.
We don't know what causes preeclampsia, do we? I mean, we can't really pinpoint why a woman becomes preeclamptic.
Yeah, exactly. Not exactly. We do know there is a male factor, and with different fathers, it seems to not be as prevalent with if a person has different fathers through her life, as well as the better shape the body is in, the less likely it's going to happen. And that's easier said than done. I mean, sometimes we just find ourselves we're a little out of shape, and then oops, we get pregnant. But we can still get in shape during the pregnancy, even if we were out of shape.
Is it more common during a first pregnancy, Dr. Cly?
It is more common during the first pregnancy. And something about the first time, and it seems like about 10% of first-time moms develop preeclampsia.
Okay.
About the same as postpartum blues. About 10% of first-time moms develop postpartum blues.
Okay. All right. We have Deborah waiting on the line, so let's go back to the phone lines. Good evening, Deborah. Welcome to our program.
Good evening.
Hello.
My question is this. After the baby's born, if there's a lot of extra skin in between the fingers and in between the toes, which eventually wears off, does that mean that the baby was overdue?
I do not believe so. Good question. Check with the pediatrician, because I'm good at delivering the babies, but I hand them right off.
Like a football.
but not. I don't believe that means it's overdue. Usually, an overdue baby, and when we say overdue nowadays, it's different than traditional. Traditional overdue was 42, 43 weeks of pregnancy. Most of the time, most OBGYNs are going to have you deliver your baby by the 41st week. It's pretty rare that we see patients go to 42 weeks. And then overdue or post-mature baby would mean that it's kind of wrinkled skin, it's dried, there's much more risk of decreased amniotic fluid or some meconium or brown staining of the fluid. And that's exactly why there are risks to the baby if that happens. So that's why we generally don't let people go past the 41st week if we can help it.
Okay.
Thank you.
Sure. All right. We have Amy on the line. Good evening, Amy. Welcome to the program. You're on the air.
Oh, hello.
Hi.
Hello.
Hi. I had an ultrasound today, and the baby weighs 340 grams. I was wondering if that's just the baby's weight or if that includes the fluid and everything, the baby's in.
Interpret an ultrasound for us,
Right,
Dr. Clyde.
right. How many weeks are you, Amy?
21 weeks,
Okay, and you said 340 grams?
340 grams.
Yeah, so that's the baby's weight. And the way they calculate that at 20 weeks is by measuring the legs, the femur bone, the head, the diameter and the circumference in the abdomen. And they take all those measurements and they have averages on babies who are around 19, 20 weeks. And then they crunch all those numbers together, and then they come up with an estimation of how much your baby weighs based on those 4 to 5 measurements.
So that's just the baby.
Just the baby, correct. And then the fluid in the placenta, we don't have an estimate of those at that point in time, but we generally say that when you add the baby, perfect weight gain, the fluid in your body and placenta, that it's around 20 to 25 pounds at delivery total.
Okay. All right. Since we're talking about weight during pregnancy, gestational diabetes, Dr. Cly, how dangerous is it?
It can be very dangerous. And if it's not controlled well and the blood sugars keep going up and the patient doesn't take it seriously or has to have medicine to control it, it could result in a stillbirth. But that's when we're talking in sugar levels in the 200 to 300 range toward the end of pregnancy. We have medicines now. Many of us can use pills too, not just insulin shots. And the first step, of course, is diet control and exercise, which many times will take care of it. But what it is the placenta secretes a hormone that throws off the body's sugars. So it's not that the patient's necessarily doing anything wrong, it's just the hormones of the placenta are what's causing it. Okay. And that is also something that can come back around 25% of the time with a future pregnancy.
Okay, so something to watch. Okay, we have Erica on the line. Good evening, Erica. Welcome to the program. You're on the air.
Yes, I was wondering, is 49 years old too old to have your first child?
You're pushing the envelope a little bit if you're 49 and having your first child. The risk of a genetic abnormality is pretty high at 49. I don't have the numbers exactly, but I would bet it's going to be 2 to 5% chance. At age 35 is when we talk about the risk jumping for abnormalities to about 1 in 300, 35 and above. Now that's still at 35 to 36, 37 to 40, it's still a 99% chance of everything being normal. At 49, again, as I mentioned earlier, a woman is really pushing her body, or the body's being pushed to make another human being inside of it. And so at age 49, the stress on the body is pretty significant with sugar problems, diabetes, blood pressure problems, preeclampsia. It does happen. I wouldn't necessarily recommend pursuing that for someone who hasn't had children yet, but at the same time, talk with your doctor about your health and the health of the baby if you are pregnant. But you certainly, if you do become pregnant, you could deliver a healthy baby. You're just going to have to really be careful about making sure that you got the right exercise, the right diet, not too much stress. Watch your blood pressure.
Okay, very good. We have another caller on the line. Sarah, good evening. Welcome to the program. You're on the air.
Hi, how are you?
Oh, just fine. Thank you.
Well, one thing that I always wondered about was how can some women be pregnant and not know they were pregnant until they were going into labor and ready to go to hospital and deliver the baby right then. I've heard of cases where, that happened. In fact, I happen to know a lady who she did not realize she was pregnant till she was like 8 months along.
Yeah, and we've all seen news stories like that. Yeah, and
Yep.
Dr. Cly, is that just the power of denial, or what's happening there?
Yeah, a lot of that's the power of denial, and in some ways maybe that's a blessing for those patients because they didn't have to suffer with the pregnancy too much because they may have just found out about it the day before they delivered. We see that every so often, and I've had some moms come in and they still do great. A big shock, of course, and usually a bigger shock to the family.
I bet.
Many times I find those patients actually have thought they were pregnant, but they really are in denial that they are pregnant. That it's just the shock of realizing they're pregnant is overwhelming. So they kind of push off the symptoms of the baby moving as maybe they got some stomach problems, maybe some challenges. And so usually by the time they come in, they say, I kind of knew, but I didn't want to admit it to myself. Okay. But they can still do very well. And what we try and do when we identify a patient like that, we just try to make the best of it. Let's go ahead and start from today, and let's make the rest of this pregnancy fantastic. Let's make sure that baby's okay, and then let's look at after the baby's born. Mm-hmm. Some of those women have decided that motherhood is not for them, and they would adopt out. And some of those women embrace it and start from there, and they can do very well.
Okay, all right, it can happen. It can happen. All right, we have another caller on the line. Joel, good evening. Welcome to the program.
Hi.
Hi.
Good evening. Welcome to the program. Hi.
Go ahead, we can hear you.
Go ahead.
Are you there? You can turn your TV down. That might help a little bit. We're on a little bit of a delay, so.
That might help a little bit. We're on a little bit of a delay, so.
I can hear myself.
Right.
Well, I think I know Joel's question. I'm going to read his mind right now. Hopefully this was something like it, Joel. But let's talk about the delivery. What's the dad going to do or the partner going to do in delivery?
Oh.
What I would always recommend, I love to see, is when the partners can help out in any way possible. Maybe it's just helping to put a cold washcloth on their partner's or their wife's forehead. Maybe it's just giving support, or maybe it's really being involved in the labor and some of the coaching process. And the best thing that us dads can do is just be there and support your spouse or wife or partner during this process, because for your wife or spouse or partner, it's a very unsure process. It's new territory for them, and for us dads, it's an unsure process. Mm-hmm. And us dads always like to try to fix things. Men like to try and fix things, and sometimes we can't. We just have to help and be supportive. So that's the thing as a dad or a partner or a future father. During those 9 months, try to just be supportive. You won't be able to fix everything, and sometimes you might have to just close your mouth and listen and not talk back, and that's the best
and
thing
important too.
You can do. Yep.
That is very important.
Yep.
Okay, I think I know what the problem might have been. I was calling the person Joel, and it's Nicole.
Oh.
I had the name wrong, so my apologies. Nicole, are you there?
Yes, I am.
Ah, yes,
Hello.
Go ahead. We can hear you.
Yes, I was wondering what you can do when you turn 41 weeks and you're overdue, but I want to have a baby at 39 weeks.
Good question. What you're talking about is there any way that you can help augment or induce your labor process safely and naturally? And there are a couple things you can try. Nipple stimulation, massaging or rubbing the nipples will make your body think that a baby is breastfeeding, and so it'll secrete a hormone from your brain that'll give you some contractions. That's okay to do. Check with your doctor to make sure there's nothing else going on, or that you're too early to do that. It won't throw you in labor the next day, but it'll get your body thinking about labor. The semen also have prostaglandins that will help soften the cervix. Now, you may not feel like that toward the end of pregnancy. So I would only look at that option if that's something that you're interested in and it's not going to hurt or be uncomfortable. Walking and exercise is also something very good. But a lot of times we have to work with your body, and sometimes your body is saying it's not ready for labor. So we want to try and have a healthy delivery. We'd love to have a vaginal delivery. That's the ultimate goal. But with that, a healthy mom and a healthy baby is so important. And I usually tell my moms who end up with C-sections, the C-section is not the end of the world. It doesn't mean like they did something wrong. It just means that your baby was meant to come out a different way, but still you're a great mother, and we're going to have a beautiful, wonderful baby. And we try and just make it the best situation possible and have the best experience, because you might only do this a few times in your life, unless you're Amish or Catholic, maybe 10 or 12. But if not, let's make this the best time it can be.
All right, and it's C-section. There are women who feel like they have failed, don't they, Dr. Cly, if they have a C-section, and not the case at all. The ultimate goal is to have a healthy baby, and a C-section can many times provide just that.
Oh, absolutely. Sometimes a C-section can be better. Depends on the situation, especially when you have a 7-foot partner and a 4'5" patient, because sometimes the baby's 9 or 10 pounds, and there's just no way it could fit. But a C-section is not the end of the world. Maybe that's what was meant to be, but we try to always want to think in ways, or we don't want to cause a C-section, so we try and do things as naturally as possible. Try and promote the natural way, promote a healthy expectation, healthy body, healthy lifestyle, and a lot of times that'll result in a great vaginal delivery, and the patient does so well afterwards also.
Can you have a vaginal delivery after you've had a C-section?
You can have a vaginal delivery after C-section. There are some issues with that, and there are some risk with that. The risk is of that uterine incision opening up during labor. And there's about half the people in town who will do a vaginal delivery after C-section, and about half the people in town who say, I'm not comfortable with that. I'm in the half that says, I'm not comfortable with that because I've seen some problems happen, and it scared me very badly, and I just feel like I wouldn't necessarily want to do that myself, so I don't feel comfortable.
It's just a risk that just doesn't need to be taken, right?
It doesn't need to be. But at the same time, it's still acceptable, and it can be done safely. So I have partners who will do VBACs with their patients, and usually I try to facilitate the patient. Okay, if you want to do this, let's look at it. Is it possible? Is safe within those risks? And if so, then I'll have you talk to one of my partners to facilitate that.
Okay. All right. We have Brandon on the line. Thank you for holding, Brandon. Go ahead with your question.
Yeah, we had went to a 21-week ultrasound earlier today, and they gave us a 95% chance that it was a girl. Now, how often are they wrong? And is that 5% chance? Could it be possible it's a boy?
95% chance is pretty good, and most of the time they are not wrong. I'd say the accuracy in our office is 99.5% accuracy. And usually what that tells me that tech was pretty confident in what she was seeing, because our ultrasound techs at our office, if they're not confident, they're never going to go 95%. They're going to say, I think it's a girl, maybe 50, 60%, keep your receipts. But when they tell you 95%, they're pretty sure that's what it was.
Okay.
Okay.
All
right. Thank you.
Sure.
We have Phil on the line. Good evening and welcome to the program. You're on the air.
How are you?
Hi, just fine.
I'm calling this evening for my wife. We found out recently that we're pregnant.
Congratulations.
Thank you. And I guess I have a twofold question. One is about, again, what type of weight gain is she, I guess, curious to that she should expect to gain? What's as a normal weight gain during a pregnancy?
Great question. And you have a challenge because all the holidays are in your pregnancy. Christmas, Halloween.
You're correct, yes.
Yeah, and everybody's going to want to feed your wife a second plate. They just do. There's no way around that. But usually the true weight gain, that has changed recently from what we used to recommend. And the simplest way I like to look at it is ask your wife what she would like to weigh. If it was a perfect world, where would she want to be? And then take around 20 pounds up from that, 20 to 25, and that would be a perfect delivery weight. So if she said, I'd love to weigh 125 pounds, if your wife weighed 150 at delivery, then she'll lose that weight. She won't overfeed the baby during the pregnancy. She'll decrease her risk of challenges. But what if your wife weighs 150 right now? Then what she could do is convert the extra weight she has over to the baby by trying to stay the same weight with exercise, diet, healthy water intake. And we'll show you that the baby's okay because we do ultrasounds through the pregnancy. Knowing that I've done this for over 10 years, I say that stay the same weight. Very few people can actually do that. Most people gain a few pounds. So if you shoot to stay the same weight, if you've already have that 25 pounds, you'll gain a few extra, and when you deliver, you're going to be proud to walk around that postpartum unit because you're going to feel good and look good.
Okay, we have about a minute left, Phil.
Okay. All right. One other real quick question, I guess, maybe. You always hear the wife's tales and everything, but what maybe can we follow about how the chance of having twins if it runs in people's family?
Huh?
Yeah, great question. The chance of having twins naturally is 1%. Chance of having twins, if it runs in your family, is probably somewhere up around 5%. Not a huge increase, but a lot extra nausea and vomiting can signal twins in many cases. Or if you haven't had an ultrasound after the first few months and you seem to be growing or getting much bigger with the uterine size, that can signal it also.
Okay, very good. We are out of time. Dr. Cly, great show as usual.
Thank you very much.
Thank you very much for being here. And thank you for joining us for this edition of Docs on Call. I hope you'll be here next week, same time, 7:30 Tuesday night. Until then, I'm Liz Schatzline. Good night.